Well, good morning to everybody. I have been connected since 1 a.m. in my country. It is a pleasure. Thank you for the opportunity to share data. Especially with post-COVID syndrome, that is very little published, especially from low-income and middle-income countries. So my title is Post-COVID Syndrome in Honduras. I'm going to talk about the prevalence that we found, the systems more affected, and if there is an association between post-COVID syndrome and the severity of the first COVID episode. Um, I don't know if this is it running? Is it running? Yes. So I declare that I have no conflict of interest. I have to say that Honduras probably has the most beautiful beaches in Latin America, the second largest coral reef after
Manuel,
Australia,
please
and
do the slideshow,
mhm.
slideshow
I
presentation.
Yes, I'm trying, but I don't know why. Is it now in show?
You have on left side top, I can see in your screen, resume
Hmm.
slideshow. Maybe your right side top.
Yeah, I have it.
Yeah, you can click that.
Okay. And the most beautiful
Still, we did
Mayan.
not get, still, we did not.
Okay, okay, but let me go. This way. Because I have three screens in my connected to my computer, and sometimes I don't know. It's a mess. But anyhow, this is a joint effort with some colleagues of the University of Honduras and a cohort of physicians in social service. I was heavily involved with the national response. I received a call from the president to be part of a senior assessment committee. And from my experience, I would say that COVID was an amplifier, of global vulnerabilities such as global climate change, poverty, and social exclusion that was published by UNDP. The GHS index from Johns Hopkins demonstrated that there was a global poor surveillance capacity, curative health systems, and on top of that, by 2019, Lancet also was denouncing a huge silent pandemic of chronic diseases. In many countries, the weak health infrastructure failed to adequately respond to the pandemic. The school closure deepened the educational inequality and mental health changes, and this huge pandemic really demonstrated, the tremendous health inequities that exist in the world. Um, with regard to our title, the post-COVID syndrome refers to a wide range of symptoms that persist or emerge after the acute phase of COVID-19, typically lasting more than 12 weeks. There's still no universal clinical definition existence. Systems are multisystemic and vary widely. There was a lack of awareness about general practitioners. It affects mainly vulnerable populations, as I heard in one of the previous conference. There is no standard treatment, and most of the national health strategies they don't formally recognize. They don't have an interdisciplinary response for this huge problem. Our objective was to estimate the prevalence of post-COVID, the systems affected, as well as the relationship between post-COVID and the severity of the first episodes. We developed a proposal that had an IRB reviewal. So with a cohort of 14 students in last year, undergraduate students that were distributed through the network of primary health cares um, organized by the Minister of Health. We conducted the study. The only criteria to participate, once informed consent was issued, the only criteria to participate was Did you ever have COVID-19 during 2020 to 2021? And if the response was yes, and informed consent was given, then they were elected to participate in the study. So we did the study for nearly 8 months. We enrolled nearly 3,000 participants, 60% female, 40% males. You have there the age distribution. We have more or less in all the different representation of different age groups. 40.3% of our people were overweight, 31.3 were obese, 17% have hypertension, and 12.2 have diabetes type 2. With regard to the first COVID episode, we asked, I mean, by the time that you had this first episode, were you vaccinated with the COVID vaccine? So we found that 35.2% had received at least one dose of COVID vaccine. With regard to the clinical spectrum of the first proven SARS-CoV infection, 30% were asymptomatic, 60.8 mild symptoms, 6.6 were admitted to a hospital with moderate symptoms, 2% with severe disease, and 0.4% were admitted to intensive care unit. So we divided the group, our population in two groups. 90.9% were asymptomatic or mild disease, and 9.1, 270 people were admitted to hospital or either have a severe disease or were admitted to an intensive care unit. Among the 2070 with symptoms that require admission to hospital or severe disease, only 20% have received at least one dose of COVID vaccine before the first proven SARS-CoV-2 infection. So we found an odds ratio of being unvaccinated of 2.3%, which was statistically significant. Post-COVID syndrome, we found a proportion of 51.5%. That is the 95 confidence interval there. Among the 2,070 individuals with symptoms that require admission to a hospital or have a severe disease, 249, 92% reported post-COVID syndrome. Compared to the 2,600 individuals that have asymptomatic or mild disease, only 47.4% have reported post-COVID syndrome. So we found an odds ratio of 13.1%. In other words, people who have severe disease in the first episode of post-COVID syndrome, they have 13.1 times the probability of having post-COVID syndrome. The systems affected were respiratory, 69%, neurological, 68%, systemic, 65%, psychiatric, 33%, cardiological, 32%, cognitive and gastrointestinal, 21%. With regard to the number of post-COVID symptoms, 55 have 1 to 3 symptoms, 24 4 to 6, 15% have 7 to 9, and 10% have 10 or more symptoms. Among the people with post-COVID syndrome, a total of 143, 9.3% have what we call persistent post-COVID syndrome, which were symptoms that last for more than 24 months of duration. Individuals with mild asymptomatic disease, 243 have more than 7 post-COVID symptoms, and 93 have persistent post-COVID symptoms. And then compare, for example, to people who have a severe disease in the first COVID episode, 47% have more 7 or more post-COVID symptoms, and 38 have persistent post-COVID symptoms. So we found that the prevalence of post-COVID syndrome was clearly related with the severity of the first episode. The number of symptoms were also related with the severe first episode, and persistent post-COVID syndrome was also related with the severity of the first episode. So, in conclusion, I mean, very early in the pandemic, the vaccine demonstrated effective protection against the severity of the disease. The post-COVID syndrome proportion was 51.5%. Post-COVID frequency is related to severity of first COVID episode. I mean, an odds ratio of 30.1. The systems more affected were respiratory, neurological, and systemic. 9.3% of the people have persistent post-COVID syndrome symptoms with 24 or more months of duration. And severity of first COVID episode was significantly associated with persistent post-COVID syndrome and with a high number of post-COVID syndrome symptoms. Um, so in general, there is a big gap in our countries, I mean, on how to deal with this large cohort of people that were affected during the pandemic. Um, uh, Most of our countries, they lack of clinical decision tools and guidelines to support diagnosis and referrals. Um, Special attention should be given to patients who experience moderate to severe COVID-19, as they are significantly more likely to develop persistent. We definitely need a multidisciplinary unit to address the diverse symptomatology of post-COVID syndrome. It's very important to allocate funding for rehabilitation, and for sure we want to, I mean, we need more studies, I mean, on trying to really understand, I mean, all the different links with the pandemic and the post-COVID syndrome. So that's what I have. Thank you very much.